Hi, this is Geoff with Wellness Keys for You, and I'm in St. Petersburg, Florida today, and talking to Dr. Dewitt Wilkerson, a dentist, talking about sleep apnea and health. So,
Hey,
Dr.
Geoff.
Wilkerson, hi, how you doing?
I'm doing great, thanks.
So first, I would like to ask, why did you decide to offer a home test for sleep apnea?
Well, sleep apnea is a big problem in our society that very few people know about. It turns out that almost 30 million people in the United States suffer from sleep apnea, which basically means where you stop breathing. If you don't take a breath for 10 seconds or more while you're asleep, that's considered an apneic event, the absence of breathing. And some people will do that all through the night, and there's some huge implications to that. So what we've learned is the fact that very few people are even being screened for this problem. Less than 15%, we project, of people suffering from sleep apnea, 30 million, are even being screened for it. So first of all, we felt like we in dentistry would be an excellent place to be gatekeepers for whole health, including airway problems, which is so close to where we're working,
Absolutely.
that we would go ahead and begin doing that. You can do that with just written questions, but also now they've developed home testing, which is like a little iPhone, hangs around your neck, and there's a little finger connection there that measures oxygen levels, and a little nasal thing that measures breathing. Very simple, you can do it in your own bed, and you can learn from that whether there's apnea going on, whether the heart rate is being affected, whether oxygen levels are dropping below uh, safe levels during your sleep. Very, very easy to do. We screen that way, and then with the home monitor, the results we get back, if it indicates in the summary that there may be sleep apnea, then we actually will send the study to a sleep physician and have them interpret it, because we don't do that.
Okay. What would be, like you said, so many people could have it and don't even know they have it. What could you explain to the listeners the consequences of not addressing a sleep apnea condition if they just let it go and go and
Sure.
go?
Well, first of all, to have an idea of whether you might have sleep apnea, some of the things that go along with that is snoring. So snoring is an indication that the airway isn't completely open. The tissue is vibrating against the back of the throat. So many people, maybe a third of people with snoring, also suffer from sleep apnea and don't know it. Tiredness during the day. Do you feel sleepy during the day? At lunchtime, could you sit down on the couch and just go straight to sleep, or sitting in the car even? So tiredness during the day. High blood pressure is often associated with sleep apnea. You can develop type 2 diabetes related to sleep apnea.
Yes, I was reading about that.
Cardiac arrhythmias, heart irregularities, and heartbeat. Memory loss, things like that. We just feel foggy all the time. Very, very common with sleep apnea. Gaining weight for no good reason. I'm not eating more, but I'm gaining weight, because it can affect your metabolism. And many people suffer from exactly that. Other things would be like a sore throat, hoarse throat, things like that, that can go along with just airway obstructions or swelling or inflammation in the airway. So those are some of the things. Now the implications are huge, because there's been association with, as I was mentioning, cardiac problems. What happens when you stop breathing is just like choking. So your oxygen levels drop, and then it stimulates your stress hormones, just like adrenaline, cortisol, to go up. And then that makes your heart beat faster, because the brain is saying, we're not getting enough oxygen here, so heart, we need you to pump harder. And so your heart rate goes up, and you can go through a cycle where you kind of wake up, not completely, everything normalizes, you go back to sleep, quit breathing, cortisol levels go up, heart rate goes up, you wake up, and you repeat this. Well, it's very stressful to your heart. It's very obviously stressful to your body if oxygen levels are dropping below normal, and sometimes very severely below normal. And then the cortisol also affects things like insulin in your bloodstream, which relates to blood sugar. So if you develop an insulin resistance as a result of high stress hormone or cortisol levels, you can actually develop type 2 diabetes from sleep apnea. Heart problems. People have died in their sleep from sleep apnea. So If you read about like Chief Justice Scalia
Mm-hmm.
died in his sleep, Reggie White, the very famous football player, died in his sleep. Tim Russert, the news anchor for political news, died in his sleep. You wouldn't expect to die in your sleep of a heart attack, but that's exactly what happens. If your airway gets blocked, oxygen levels
Right.
drop severely, stress the heart, and you can have a heart attack at the least likely time.
Do you see people when they're told about this, say men in particular, who are always healthy, I'm not sick, do they kind of balk at it at all? Because one thing I recently read was another not side effect, but a consequence of sleep apnea with men is erectile dysfunction.
Absolutely. So I wouldn't say that men have balked at it or anyone's really balked at it because it's so simple to screen. So, it'd be foolish. It's like looking at your blood sugar levels or anything like that, where it's logical that that would be a good idea. So, no, actually, I think one of the breakthroughs has been that now insurance companies are accepting home sleep monitors.
Oh, good.
So in the past, you've always had to go to the hospital or the clinic and spend the night in a lab with somebody videotaping you.
That's
So many people think, I don't want to do that.
Yes, not exactly a comfortable place
No.
to sleep.
In fact, there was a large-scale study done, and of 100, if you worked it out, of 100 people screened for potential sleep apnea and told that the next step was to go to the hospital or the clinic and do an overnight study, 40% declined.
Oh, wow.
Even though they could be at risk because they didn't want to do that.
Oh, my gosh.
And I think maybe another reason some people decline was they know what's coming next, a CPAP,
Yeah, yes.
and they don't want a CPAP. And that's another place where we come in.
So what is your approach after you've gone through all of this? What is your approach to care for apnea? I know there are dental appliances.
Yes. So this is a medical problem, but there often can be a dental solution. And it can come in multiple ways. One is if someone has mild to moderate apnea, not super over the top severe, in which case you're almost 100% of the time going to recommend a CPAP, a mask that blows air into your lungs and keeps you full of oxygen. So that would be the right thing to do if someone was severe, in danger. They could die in their sleep. But most people are mild to moderate sleep apnea. And the trick is to open the airway. So you can open the airway by pushing air down the airway or by moving the jaw forward and opening the somewhat blocked airway. So we have oral appliances, dental appliances that go in the mouth that move the chin forward and hold it there, which opens, or we call it dilates, the airway. And that can very often be just as effective as a CPAP. The other thing that's being done more and more today is often the mouth, we think of it like, if you think of it as a box where the tongue fits, if the box is too small and the tongue doesn't have room, the tongue will drop back. So many people have very small constricted mouths, or they breathe through their mouth, not through their nose. Their tongue lays low, their palate is very narrow, and their nasal airway is very constricted as a result. So we're doing a lot of orthodontic expansion, even in adults, expansion of the arch on the top and the bottom to give the tongue more room and to kind of open up the whole airway. And it's miraculous, almost, some of the results that we've seen.
I guess that's better than reducing the size of the tongue.
Yeah, no, we don't do that. Yeah, we don't do that.
Well, okay, we'll keep this short. I want to thank you very much for your time,
Thank you. I've enjoyed talking to you.
This has really been great. And this will be our first interview on our Wellness Keys for You. And this is Geoff signing off. Thanks a lot. We'll see you next time.